when we are seeing something from a bigger umbrella, say for example, one of the good question, I guess someone asked me just 2 days back. I think it was Geeta ma'am who asked. Okay, now we have understood that. Let's take an example of Superclass 1 because that's what we are going to do the next. And why it is important to learn it. Overall, we have understood that we are going to see something very, very submissive, very meek kind of personality for whom everything is too much. We understood that. Okay, fine. Up till now, we were dealing with a lot of, qualities of animal, mineral, plant. So with that, we have understood also that this is a plant remedy. Say, for example, I have understood that some plant remedy would help this patient. After that, we have also ideas about each family. Say, for example, Papaveracea. Say, for example, Ranunculaceae from subclass 1 of the plant kingdom. Now, when you reach to subclass 1, and then under that, Ranunculales, the order, okay? The newcomers don't get jumbled up. Everything of it, we are going to do step by step. I'm just trying to plant a seed so that when you come for the workshop, you will come with the full vigor and with full attention that there is something very, very important that is going to be disclosed. And I have to be fully aware and utilize my time to understand it. So we reach till Ranunculales, the order Ranunculales. Now under that, there are various families like Ranunculaceae, Menispermaceae, Berberidaceae. Okay, take 3 examples. Now we have a patient who is talking about my mood keeps changing, doctor. Sometimes I'm very, very happy. Sometimes I'm very sad. Sometimes I get too much involved in something and sometimes I'm just, very, very indifferent. So sometimes it's difficult for me to understand who am I, what I really want in life. And it becomes difficult for me to connect with anyone. Now, the periods. Sometimes I get very heavy flow. Sometimes I get very light flow. Sometimes it is like, 2 days. Sometimes it is 4 days. So it keeps changing. Interestingly, doctor, my handwriting also keeps changing. If you read my book, page number 1 and page number 3, page number 7, you will feel that 3 different persons have written this. But I am the one who have written this. I don't know why it keeps changing, why there are no fixed pattern to my personality. Now here what we are seeing is changeability. Okay. Let's see if I can show you over here.
Yes, ma'am.
Okay. So let us take this example. Mind changeable, fickle. Mind indecision, irresolution, changeable. Can't decide. Every time the decision keeps changing. Mind moods changeable, variable. And how? Rapidly. Appetite changeable. Uterus bleeding, color, flow changeable. Mood changeable, variable. See, there are multiple remedies. Now we know, as we discussed, that it's a plant kingdom. So let's limit it to plants. We have, this is the setup, and we have the spokesperson kind of a remedy for this changeability, that is pulsatilla, which is known for its changeability, the weathercock. Now we know that it is from ranunculales, as we discussed. The remedy is from ranunculales order. So let us limit it further to ranunculales. Now see here. Pulsatilla will obviously steal the show because it's a polycrest remedy. Highly prescribed, multiple times proven. But along with that, what is coming? Cocculus indica is coming. Again, many spermaceae family of the same order. Aconite is there. Sister concern of Pulsatilla from Ranunculaceae. Simicifuga is there. Staphylos agria is there. Helleborus is there. Another version of aconite is there. Actia spicata. Ranunculus bulbosus. Scolophyllum. Ranunculus scleratus. Podophyllum. Clematis erecta. Berberis vulgaris. Now, when we say changeability, what comes to our eyes is only Pulsatilla because it's like 26 aphorism. It's the most dynamic. It becomes like a sun rays and everything else just fades away. So why to learn this superclass understanding, especially, and below it, the subclass, which also we are going to encompass in each workshop. These mind peculiarities, these subtle peculiarities, which otherwise we just overlook and we try to prescribe something general. Now here the question comes, will it not work? It will. To some extent, it will. But what we have seen is, after a point of time, the progress in betterment just stops. Now, why? Because that is not the seat of action of that remedy. My dear friends, this is very, very important. Now, you take a remedy like Ranunculus bulbosus or scleratus, which is again a sister concern of Pulsatilla. Same family, Ranunculaceae. But these smaller remedies have their own distinct special seat of action, special side affinity, special organs, and special sensations. Now, if we see getting affected by something trivial, and in that response, I'm trembling, I'm weeping, an electric current shocking through, going through me, an electric shock going through me, and I'm becoming like a live wire, shaking and trembling and, cannot handle my own emotions, is the central theme for ranunculales. It is exhibited in its heightened form in Pulsatilla and Staphylos agria, remedies like these. So others take a back step. It is not that in them it is not there. So when we say changeability, which remedy you will give? Pulsatilla? No, boss. Others are also there. But they exhibit changeability in various dimensions. Some has changeability in the mood. Some has changeability in the discharges. Some has changeability in the direction of pain or location of pain. So, for each case, individualistic approach, what is the problem? As Sir says in the W's, where is the problem? What is the direction of that problem? What is the seat of that problem? This breaking down of understanding which superclass, which subclass, which order, which family, and in that, which remedies. So you are giving each remedy their due respect. Why? Because they have their own individual characteristics. So by doing like this, you will not miss these gems in your prescription. And that is what at least I can see that in my own practice from past 3-4 years. Earlier, when it boils down to ranunculaceae, miasm is not seen. What is the remedy that is coming on the repertory chart? Pulsatilla, give it. It works. Up till certain extent, it works because it's a polycrest remedy. It has its roots to various organs. But when it comes to a specific action, especially right, like I remember one case where we have prescribed a case of infertility and in a woman who was extremely anxious, extremely fearful. We have prescribed her ranunculus scleratus with a typical, side affinity, typical understanding of sensations, dreams. These smaller remedies has a very, very peculiar dreams. So this process of, breaking down things and learning makes our prescription very accurate, number one. It actually makes us familiar with all the possible proven remedies in homeopathic materia medica. We use them, we expand our knowledge, we expand our prescription, and we actually bring their quality for healing humanity. We are just not doing, what we can say. We are not throwing stones in darkness. We know what we are doing. And that brings confidence, especially to my young friends, young homeopaths. What will bring in confidence is knowing what we are doing and how it has to be done and why we are doing that and why and with what confidence we are telling the patient that you are going to get better because you have jotted down everything, you have worked on it, you know the path, and you have read it. You know what you are prescribing. I hope it is clear for everybody what I'm trying to convey. So please convey this message to all our friends and colleagues, the importance of attending these classes, because the intent is very clear. We all want to be on the same page for all the persons, for all the patients who are coming to our doorstep. This is not something out of the box. This is in the mainstream, having a solid foundation of organon and materia medica. And the concept was, that's what Dr. Hahnemann has left behind for all of us to act upon.